Coming to our 9th question. So a 7-year-old girl. Okay, now this is another important thing when they give a younger age, like as young as 7 and a younger female. These two should always, you should be careful. As soon as you start reading 7-year-old, a 35-year-old female, a young female, you should be very careful. Those are the questions where you're supposed to read right from top till the bottom without missing a single point. Okay, very important questions. Even this, a 7-year-old girl is brought to the physician because of increased swelling around her eyes. Periorbital edema, clue to renal pathology. And over both her feet for the past 4 days. This is acute condition. During this period, she has had frothy light yellow urine, frothy proteinuria. Yellow urine is fine. Her vital signs are within normal limits. Physical examination shows periorbital edema and pitting edema of grade 2, which is above the ankle basically. A urine analysis of this patient is most likely to show which of the following findings. That's good. So urine analysis, let's see what they've asked. Oh, they've asked casts. Like I said, cast is a very easy question. So going back to pitting edema, like I said, the grades, there are several grades. Below the ankle is 1, above the ankle is 2, below the knee is 3, and complete generalized edema, which we call as anasarca, is grade 4 pitting edema. Okay, why I mentioned this is because if people here who are new to clinical medicine, I don't want you to get confused. Okay, all right. So don't worry about pitting edema, just focus on periorbital edema given here, because periorbital edema means it's renal pathology, it's an acute renal pathology. She's a young female and proteinuria, right? Okay, so they're asking what kind of casts do you see? Can anybody like think what kind of cast you will see in a proteinuria condition? Okay, let's dive. It's fatty casts. That's the answer. Okay, this is a very straightforward question. I'll just tell you how. What's the concept here? It seems like a very easy question, but there's a pathology behind this. So you're losing protein. So why do you see oncotic? Why do you see edema? Is you're losing protein, decreased oncotic pressure, and you see edema. Fine. I'm very sorry if you are hearing any background noises. Okay, then where was I? Edema seen in proteinuria and decreased protein condition in the body. You'll see edema. That's why our patient has pitting edema and periorbital edema. Next, coming to liver condition. What exactly happens in your body when your body faces decreased protein? So your liver starts getting active. It'll be like, oh, there's no albumin in the body. Let's start preparing albumin. So it goes, the biochemistry cycles start behaving abnormally, and there'll be a lot of production of fat, lipids. The lipids start getting excreted. Okay, now what happens if you excrete a lot of lipids? They'll get absorbed in the proximal tubular cells, and when they get absorbed, they'll stay in those epithelial cells, and over a period of time they get shed. That is why in proteinuria you see fatty casts, very typical. Okay, now coming to the other part, hyaline casts, seen typically in dehydration, so not relevant. WBC casts, seen in interstitial nephritis and all those pyelonephritis and all those conditions. It's a infective pathology in the urinary tract. RBC casts, I said, like in glomerulonephritis and nephritic syndrome, all of that, you'll see RBC casts. Medi-Brown casts, that is seen in acute tubular necrosis. And waxy casts are seen in chronic kidney injury, right? And epithelial casts are seen normally in hypovolemia and all of that. But the epithelium should normally also you can see epithelial casts. So it's a very easy question, but you should always remember we have solved one question on muddy brown casts as well. So try to try to learn up those casts well so that you can solve these questions. Okay. Now you understood what is the pathology behind having fatty casts in a proteinuria patient, correct? Okay. So the concept learned here is memory plus pathology and physiology. It's a combination of casts you learned. Now I told you what is liver pathology, and I told you how it gets absorbed. That's your physiology part, how it gets absorbed into your proximal tubular epithelium, and then it gets shed over a period of time, right? Okay.